In this video, I will go ahead and share with you how to structure a SOAP note, the primary purpose of writing a SOAP note, and a sample of what an orthopedic SOAP note looks like. Then I will share with you the key components that you should never miss when writing a SOAP note. Make sure you stick around to the end because I will also review a step-by-step approach that I use to document a focused orthopedic SOAP note. Then we're going to go ahead and put it all together to make sure that you learn how to do this in practice by examining a typical orthopedic clinic case. There, I will make sure to go over all the common ortho acronyms used on notes, and I will also show you how to write it down quickly. Also, I'm going to go ahead and share with you how to access the free Must Have Ortho guide for nurse practitioners. So stick around to the end. Hello everyone, it's Jessica here from MP Insiders, where I help you expand your nurse practitioner clinical knowledge and fast track your career growth and practice, all while making it enjoyable. You've come to the right place. If you're new here, make sure that you click that subscribe button, and you can find all the links that I mentioned here in this video by reviewing the description box below. So let's jump into it. Good clinicians write good SOAP notes. Let me repeat it again. Good clinicians write good SOAP notes. But I get it. Writing patient notes can be a struggle. It can be a pain. And unfortunately, it is mandatory for billing requirements. And if you work for someone, they're going to make sure and ensure that you are documenting properly. But more than serving a purpose of billing, the real purpose of these clinical notes is to contain essential information that is communicated amongst healthcare team members. SOAP notes must tell a story, your story about the patient and the reason why they came to you, and outline your critical thinking and also your plan of care. These notes will show your ability to gather a good history, good physical exam, and to use all this information and clinical knowledge that you have to reach a diagnosis and logical plan of attack. So let's break a SOAP note down. You will read these notes in the future, especially if you continue to follow up with these patients. So pro tip, listen, rewind, and listen again. It's better if you write a SOAP note the right way from the get-go because it does become handy and accelerates your evaluation in the future, especially if you're going to be following up these patients. One last thing, remember that these notes are part of the patient's medical record. I don't want to scare you, but make sure that this information is accurate. Please make sure that is accurate. So then the logical question, right, the reason that you're here is, what is the structure of a SOAP note and what does a medical SOAP note look like? Well, the acronym SOAP tells you the four main components of a SOAP note. They are S for subjective, O for objective, A for assessment, and P for plan. Each of these main components have subcomponents or subparts, and we're going to go and spend some time in detail going through all of them. All right, so subjective. Subjective is the information that you gather, the information that you get from your patients, from their family members. That information comes from your patient interview and the review of the chart. The subcomponents of this section include things like your chief complaint, and make sure that you always get that from your patient, the history of present illness with all the questions that I've reviewed in other videos, so make sure that you check those videos out too. Your past medical history, your past surgical history, your family history, if it's pertinent, your social history, and also your review of systems. All of these subsections are typically included in a comprehensive history and physical note. But beware, not all notes are H&Ps, and they do not all require all of this information. Actually, let me know if you want me to explain which encounters should contain all the subsection and the details of a SOAP note versus those that don't. For now, let's keep it simple. Let's keep going to the next SOAP section. So the next SOAP section is objective, O for objective. Here, you will document the facts. That is what you physically found during your physical exam. Pro tip, this part only contains your observations and your findings. This is not what your patient reports to you. This is not what the family member thinks. The subcomponents of this section include the following: the vital signs, your general survey or the general appearance of your patient, the HEENT, the lymph nodes, the lungs, the cardiovascular assessment, abdomen, rectal if it's indicated, genitalia or pelvic, the extremities, upper, lower extremities, the neurological system, and also psychiatric system. How long or short this portion of the SOAP note is will depend on the type of note that you're writing. Again, if it's an H&P, you want to make sure that all of these things are covered. But if it's a focused assessment or if it's a sick visit, then you can definitely tone it down, and just focus on the reason that the patient is there. At the end of the day, you are the storyteller here, and this is your story. So make sure that you have all the information that you think you need to say it right. This section also includes your diagnostic imaging and laboratory test results that are needed for you to reach your diagnoses. If it's pertinent, go ahead and add it to your SOAP notes. Okay, next section is A for assessment. This section is the meat and potatoes of your note. Pro tip: this section is likely the first section that your colleagues are going to go ahead and read when deciphering your thought process and clinical evaluation and thinking. This section also typically summarizes your findings, your differential diagnoses, starting with what you think is the most likely diagnosis that your patient has. The next and last section of your SOAP note is P for plan. Here is where you shine. Actually, your patient shines, because your patient's going to go ahead and do what hopefully you're explaining them to do. Here's where you decide what to do with all of your gathered information. For example, it includes the prescription medications that you're going to order for your diagnoses. It includes your counseling, diagnostic testing that you want to get, treatment plans, and make sure that you don't forget the patient education. If you give a patient antibiotics, you want to make sure that you educate how to take them, when to stop them, when to begin, how often, and also what side effects to look out for. That was just an example that came to my mind. But this is critical. Patient education is critical for them to be able to proceed with the plan that you have created for them. So now we're going to jump into a PowerPoint presentation where we're going to go over what a SOAP note looks like, specifically an orthopedic SOAP note looks like. So SOAP note structure. The SOAP note has 4 parts. S for subjective, O for objective, A for assessment, and P for plan. Subjective is what the patient tells you. Objective is what you as the clinician find and can correlate clinically. A is for assessment, and that is what you think is going on based on your clinical findings from both your subjective and objective information. And P for plan, it is the result of your findings. Basically, it is what you plan to do with the diagnoses that you made. Okay, so here we have our patient, a 64-year-old male with a chief complaint of knee pain. Like I said, I'm not going to go over everything here in detail. Mainly the purpose of this presentation is just to show you like the components of the SOAP note. So we're going to start with S for subjective. In the subjective section of the note, you have the chief complaint, you have the history of present illness, then you also want to include the medications the patient is taking, the allergies, that's something you don't want to miss, the past medical history of the patient, the past surgical history the patient has, the family history, if it basically adds something to the information that you want to gather. The fact that the patient is a non-smoker is key. You want to know the smoking status, the social history in terms of the alcohol use, any illicit drug use that the patient has. This is all part of like the social piece. Then you want to go to O for objective. Here is where you have the findings that you gather. So you have the vital signs, the physical exam. This is what you did. And for a focused type of note, you can actually be more conservative with the physical exam, meaning you don't have to have all the components. You can have something like general assessment, lungs. If it's a musculoskeletal MSK problem, then you can have the limb that is involved, and then psych, right? Now, if this is an HMP, then you definitely want to be more thorough. Then we go continue here in objective. You also want to have the labs, right, that you find in the chart or that you order that can lead you and guide you to your diagnosis. You want to also include any imaging findings that are pertinent to your visit. Then we go to A for assessment and P for plan. You can do it two ways. You can either have assessment first and then plan, or you can bunch it together. So here we have them together because they do go hand in hand. Then the assessment mainly is what you have as a diagnosis and also your differential diagnoses. And then the plan is basically where you're going to tell the patient to do, hopefully, so that that the diagnosis could be addressed. But like they say, there are many ways of skinning the clinical cat. That is, there is rarely a single correct only way of doing things, especially in clinical practice. Instead, there are many approaches. However, this approach that we just went over has worked for me and definitely speeds up my process. So I've decided to make part 2 of this episode just to go into more detail of what a SOAP note is and looks like. There, I'm going to share with you a focused orthopedic SOAP note based on the one that we briefly reviewed. So get ready, because we're going to put it all together. We're going to put all this knowledge into that section. I will also go ahead and quickly show you the acronyms to look out for when reading orthopedic notes. There's quite a few of them. Yes, I know. And a lot of people don't know what they mean. But you're going to know, because I'm going to go over them. At the start of the video, I mentioned to you that I was going to show you how to access the free ortho guide for nurse practitioners. This will help you maximize your clinical skills and your time in clinical practice. So how do you do that? Well, go to the link in the description box below where you can go and grab your copy for free. Now, today, right now, stop, pause. It will be an absolute game changer, especially if you're not familiar with musculoskeletal care. That is it for now. I'll see you in the next part 2 of this video, where we're going to review it in detail, how to write an orthopedic SOAP note, what acronyms to look out for, especially when you're reading on orthopedic notes, and also how to decipher them. So I'll see you there, and thank you for watching.